Hi, everyone. My name is Dr. Arshley Florestal, and I'm a family medicine resident currently in my second year of training at the Community Health Center of South Florida's Teaching Health Center, located in South Miami and the Cutler Bay area. It is my honor and privilege to introduce you to our project called the Community Health Initiative Program, abbreviated as CHIP. You will hear me refer to CHIP throughout the remainder of this presentation in reference to our project. You will also hear me use the acronym CHI in reference to the institution where I'm currently training. As we all know, obesity is a growing health concern among both adults and children within the United States, particularly because it's linked to several chronic comorbid conditions that are associated with significant morbidity and mortality. At CHI, we serve the community within the Miami-Dade County area. Upwards of 60% of the adults in this area could be classified as either obese or overweight. On top of that, this particular community suffers from strategic socioeconomic disadvantages. They don't have the disposable income to invest in recreational centers or memberships at gyms. They often don't live in areas where they feel safe enough to exercise outdoors, either walking or playing outside. They also don't have access to grocery stores and food markets where there's a wide variety of fruits, vegetables, whole grains, herbs, and spices. Further complicating the issue is a cultural element, where many of the meals are centered around low cost, heavy meats, and processed refined carbs, as well as pastries and processed desserts and goods. Additionally, the population that we serve also has a lower health literacy. In other words, a lot of them don't fully understand the correlation between health, overall well-being, and how they move and exercise with how they eat. To combat this challenge, my colleague, Dr. Stephanie Santana Rivera, and we developed a physician-led program that would hopefully eliminate a lot of these socioeconomic barriers and enable our patients not only to lose weight, but achieve overall health. In order to fund this program, we were awarded a grant that we applied for called the AAFP Resident Care Service Award. From there, we selected 40 highly motivated women, half of which were Latina or LatinX, and the other half which were African American. From there, all 40 women were divided into 10 groups, each led by a resident physician. The program's duration is 1 year, with recruitment starting in June, July of 2021, and with the anticipated end date being June 30th, 2022. Throughout this year, we checked in with our patients monthly, and on a weekly basis, we checked in with them via a mobile app called WhatsApp. We also assessed qualitative measures such as quality of life, overall stress level, as well as quantitative measures such as vitals, specifically blood pressure, labs, specifically lipid levels, as well as fasting glucose, and body measurements such as weight and waist circumference. Some of the quantitative measures that we selected were specifically measures used to assess metabolic syndrome. As the project is ongoing, we do not yet have concrete evidence or data to determine whether or not this physician-led program led to a statistically significant change in our patient's weight at qualitative measures as well as quantitative measures. But hopefully, preliminary results are promising. We look forward to any questions you may have, and on behalf of my colleague, Dr. Stephanie Santana Rivera, and we thank you.